Question: what is the significance of postoperative gastric hemorrhage? Answer: postoperative gastric hemorrhage can occur due to bleeding vessels or inadequate hemostasis. Prompt identification and intervention are necessary to prevent complications. Question: how can the risk of gastric fistula formation be minimized after endoscopic procedures? Answer: proper patient education, adherence to post-procedure care instructions, and close monitoring for signs of leakage help manage the risk of gastric fistula formation after endoscopic procedures. Question: what is the role of gastric ischemia and delayed complications of stomach injury? Answer: gastric ischemia can lead to delayed complications such as necrosis, perforation, or stricture formation after stomach injury repair. Monitoring for signs of ischemia is important. 1095. Question: how can the risk of anastomotic leakage be managed after endoscopic procedures? Answer: proper patient education, adherence to post-procedure care instructions, and close monitoring for signs of leakage help manage the risk of anastomotic leakage after endoscopic procedures.
Question: what are the common causes of stomach injury? Answer: stomach injury can result from blunt or penetrating trauma, motor vehicle accidents, falls, sports-related injuries, and surgical procedures involving the abdomen. Question: how is stomach injury severity assessed? Answer: stomach injury severity is often assessed based on the depth of injury, extent of tissue involvement, and associated injuries using grading systems such as the American Association for the Surgery of Trauma AAST Organ Injury Scale. Question: what are the clinical signs and symptoms of stomach injury? Answer: clinical signs of stomach injury may include abdominal pain, tenderness, distension, guarding, peritonitis signs, vomiting, blood hematemesis, and abdominal rigidity. Question: how can stomach injury be assessed during a physical examination? Answer: physical examination findings for stomach injury may include epigastric tenderness, guarding, rebound tenderness, and signs of peritoneal irritation. Question: what imaging studies are commonly used to diagnose stomach injury? Answer: imaging studies such as abdominal ultrasound, contrast-enhanced computed tomography CT scans, and diagnostic peritoneal lavage DPL can help diagnose and evaluate the extent of stomach injury. Question: what is the initial management approach for a stable patient with suspected stomach injury? Answer: the initial management approach for a stable patient with suspected stomach injury involves pain management, fasting, close monitoring of hemodynamic status, and diagnostic imaging studies. Question: what are the indications for surgical intervention in stomach injury? Answer: indications for surgical intervention in stomach injury include hemodynamic instability, significant bleeding, full-thickness perforation, and associated injuries requiring surgical exploration. Question: how is stomach perforation repaired surgically? Answer: stomach perforation is repaired surgically by isolating and repairing the perforation, debriding necrotic tissue, and providing a tension-free closure. Question: what is the role of tissue sealants in managing stomach injury repair? Answer: tissue sealants can be used to reinforce sutures, seal small leaks, and enhance the integrity of stomach repairs, reducing the risk of leakage.
Question: how can the risk of infection be minimized in stomach injury management? Answer: administering antibiotics, practicing meticulous surgical technique, maintaining sterile conditions, and effective wound care help minimize the risk of infection in stomach injury management. Question: what is the role of gastric decompression in managing stomach injury? Answer: gastric decompression involves placing a nasogastric tube to remove gastric contents and relieve distension, which is important in managing stomach injuries to prevent further compromise. Question: what is the significance of abdominal compartment syndrome in stomach injury? Answer: abdominal compartment syndrome, which involves increased intra-abdominal pressure, can develop as a complication of stomach injury. Timely decompressive measures are essential to prevent organ dysfunction. Question: how can the risk of gastric leakage be managed after stomach injury repair? Answer: proper surgical technique, tension-free closure, tissue sealants, and drainage help minimize the risk of gastric leakage after stomach injury repair. Question: what is the significance of gastropleural fistula in stomach injury? Answer: gastropleural fistula, an abnormal communication between the stomach and the pleural cavity, can lead to respiratory symptoms and infections. Timely intervention is necessary to manage this complication. Question: how can the risk of hemorrhage be managed in stomach injury? Answer: managing the risk of hemorrhage in stomach injury involves controlling bleeding vessels, achieving hemostasis, and ensuring meticulous surgical technique during repair. Question: what is the role of pyloric exclusion in managing severe stomach injuries? Answer: pyloric exclusion involves suturing the pylorus closed to prevent the passage of gastric contents through the duodenum. It can be used in cases of severe stomach injuries to promote healing. Question: how can the risk of gastric necrosis be managed after stomach injury repair? Answer: adequate blood supply, meticulous surgical technique, and minimizing ischemia during repair help prevent gastric necrosis and subsequent complications. Question: what is the significance of gastric outlet obstruction in stomach injury? Answer: gastric outlet obstruction can occur due to scarring and stricture formation after stomach injury repair. Surveillance and interventions are necessary to manage this complication. Question: what is the significance of delayed gastric perforation in stomach injury? Answer: delayed gastric perforation refers to perforation that occurs after an initial injury due to tissue ischemia or necrosis. It requires prompt diagnosis and intervention. Question: how can the risk of gastric stricture be managed after stomach injury repair? Answer: regular surveillance and interventions such as endoscopic dilation help manage gastric strictures that may develop after stomach injury repair. Question: what is the role of endoscopy in diagnosing and managing stomach injury? Answer: endoscopy can be used to assess the extent of stomach injury, perform interventions such as hemostasis or stent placement, and monitor healing. Question: how can the risk of gastric ischemia be managed during surgical repair? Answer: minimizing ischemia time, preserving adequate blood supply, and careful tissue handling help manage the risk of gastric ischemia during surgical repair. Question: what is the significance of gastric mucosal injury? Answer: gastric mucosal injury can lead to bleeding, ulceration, and subsequent complications. Proper management, including hemostasis and repair, helps prevent further issues. Question: how can the risk of gastric leakage be managed after endoscopic procedures? Answer: proper patient education, adherence to post-procedure care instructions, and close monitoring for signs of leakage help manage the risk of gastric leakage after endoscopic procedures. Question: what is the role of tissue coverage techniques in managing stomach injury repair? Answer: tissue coverage techniques, such as omentoplasty or local flaps, can be used to provide vascularized tissue over the repair site, promoting healing and preventing leakage. Question: how can stomach injury be managed in patients with coexisting medical conditions? Answer: managing stomach injury in patients with coexisting medical conditions requires a comprehensive approach, considering the impact of the condition on treatment and outcomes. Question: what is the significance of iatrogenic gastric injury? Answer: iatrogenic gastric injury can occur as a complication of medical procedures. Timely recognition and appropriate management are essential to prevent complications. Question: how can the risk of abdominal abscess formation be minimized after endoscopic procedures? Answer: proper sterilization, endoscope reprocessing, and post-procedure care instructions help minimize the risk of abdominal abscess formation after endoscopic procedures. Question: what is the role of gastric drainage tubes in managing stomach injury? Answer, gastric drainage tubes can be placed to divert gastric contents away from the repair site, allowing healing and preventing leakage. They are often temporary measures. Question, how can the risk of anastomotic stricture be managed after stomach injury repair? Answer, regular surveillance and interventions such as endoscopic dilation help manage anastomotic strictures that may develop after stomach injury repair. Question, what is the significance of gastric fistula in stomach injury repair? Answer, gastric fistula, which is an abnormal communication between the stomach and surrounding structures, can lead to leakage, infection, and other complications. Efforts are made to prevent and manage fistulas. Question, how does the management approach differ between blunt and penetrating stomach injuries? Answer, blunt stomach injuries are often managed non-operatively or conservatively, while penetrating injuries may require surgical exploration and repair. Question, what is the role of tissue sealants in stomach injury repair? Answer, tissue sealants can be used to reinforce sutures, promote tissue adherence, and reduce the risk of leakage in stomach injury repair. Question, how can the risk of gastric ischemia be managed in patients with vascular compromise? Answer, addressing the underlying vascular compromise, optimizing blood supply, and minimizing ischemia during repair help manage the risk of gastric ischemia. Question, what is the significance of delayed gastric perforation in stomach injury? Answer, delayed gastric perforation refers to perforation that occurs after an initial injury due to tissue ischemia or necrosis. It requires prompt diagnosis and intervention. Question, how can the risk of gastric necrosis be managed during surgical repair? Answer, adequate blood supply, meticulous surgical technique, and minimizing ischemia during repair help prevent gastric necrosis and subsequent complications.